Good evening, I'm Professor Michael and you're watching Kini News, the show that brings you today's biggest stories. Today, Malaysia reported its lowest number of cases in over a month, and tomorrow, several economic sectors will begin operating at full capacity. Malaysia has reported 75 recoveries, bringing the total number of people discharged and cured of COVID-19 to 4,032 on Tuesday. While recoveries continue to grow steadily, Malaysia is still detecting new cases. However, it's the lowest number since March 12. Health Ministry Director General Dr. Nur Hisham Abdullah reported 31 new cases, with the nation expected to reduce it further to a single digit in a couple of weeks.
Kita sekarang ni, alhamdulillah kita setakat ni kita ada dah tempoh seminggu dah kita ada double digit ataupun dua angka. Dan kita unjurkan mungkin dalam seminggu dua lagi. Sebagaimana saya katakan 2-3 hari lepas, mungkin dalam seminggu dua. Jadi mungkin pertengahan bulan Mei kita akan dapat capai single digit. Tetapi kita sama-sama kita kena amalkan norma-norma baru kita, bukan hanya Kementerian Kesihatan tetapi juga rakyat Malaysia kena amalkan norma-norma baru, dan kalau tak ada keperluan di luar, duduk di rumah. Itulah mesej kita.
Dr. Hisham was also asked why Malaysia has yet to bring down its cases to a single digit when Thailand has already achieved this despite having a population double the size of Malaysia.
Kalau kita bandingkan dengan Thailand, memang populasi dia lebih daripada kita, tetapi Thailand tak ada perhimpunan tabligh. Right? Perhimpunan tabligh ni kita dah lewat lebih kurang 9 hari. Jadi mereka pulang ke kampung dan mukim masing-masing pada 1 Mac, dan saya dimaklumkan oleh rakan sejawat saya di Brunei pada malam 9 Mac. Jadi tindakan kita 10 hari lewat.
With the reduction of new cases, Malaysia now has 1,719 cases that are still active. Tuesday also saw the death toll rise to 100, with 1 new death. Meanwhile, the government has allowed authorised companies operating in economic sectors to resume full operations starting tomorrow. These companies will also be allowed to operate without time constraints. However, International Trade and Industry Minister Azmin Ali said that the companies must adhere to the procedures which had been set according to their respective sectors. Azmin said companies that have been authorised to operate earlier do not have to reapply for the ministry's permission to operate now. While Malaysia looks at gradually loosening restrictions, too much too soon could be counterproductive. Senior Minister Ismail Sabri Yaakob has called on Malaysians to show discipline in complying with the Movement Control Order as the nation moves into the 4th phase of the MCO.
Walaupun sekarang ini nampak berkurangan, tapi kadang-kadang dia boleh naik juga, kita tidak tahu, sebab berlaku di beberapa negara dah pun turun, tamatkan lockdown mereka, tiba-tiba kes meningkat mendadak menyebabkan mereka terpaksa menutup lebih lama daripada PKP sebelumnya. Jadi bagi saya, apa yang patut kita buat, patuh supaya kalau kita buka seterusnya sampai bila-bila. No point kita buka 2 minggu, tiba-tiba berlaku kenaikan mendadak, memuncak, spike dan sebagainya, menyebabkan kita terpaksa tutup semula.
However, with the number of green zones without COVID-19 infections growing, the government is still discussing ways to ease the movement restrictions in such areas. Ismail Sabri said the National Security Council was in the final stages of drawing up new rules. Among others, he said, the NSC was mulling whether to allow those in gated neighbourhoods, universities and high-rise residential buildings to enjoy some recreation time outdoors, but still within the neighbourhood. Meanwhile, the number of people being arrested for violating the MCO remains high, despite the MCO being in place for almost 7 weeks.
PDRM telah menangkap 489 individu berbanding dengan 606 individu pada hari sebelumnya kerana engkar PKP, yang merangkumi 465 individu direman dan 24 individu diberikan jaminan polis. 741 individu telah dituduh di mahkamah di atas kesalahan engkar PKP. Jumlah tangkapan kumulatif engkar PKP sehingga semalam adalah seramai 21,106 individu.
2 politicians learned today that they aren't exempted from complying with the Movement Control Order. Two politicians who went viral after posting a picture of them having a group meal with about 18 other people during the movement control order period pleaded guilty in court this morning. Deputy Health Minister Nur Azmi Ghazali and Perak Executive Council member Razman Zakaria were charged at the Great Magistrates Court for violating the MCO in Perak on April 17th. Netizens were angered after the Deputy Health Minister posted a series of photographs online of him and his entourage visiting a religious school in Lenggong on April 17th, which included a lunch without practicing social distancing measures. Both politicians were fined 1,000 ringgit after they pleaded guilty. The MCO began on March 18th and is expected to end on May 12 after 3 extensions. Under the MCO, all non-essential businesses and services were ordered to close and people cannot leave their homes except for approved reasons, such as buying groceries within a 10-kilometer radius. The move aimed at curbing the spread of COVID-19 has brought a large part of the country's economy to a standstill. Before MPs can attend the one-day parliament sitting next month, they will have to be tested. Lawmakers will be required to undergo COVID-19 testing on either May 14 or 15 as a prerequisite to attending the one-day parliament sitting on May 18th. DAP's Bukit Bendera MP Wong Hon Wai confirmed getting a letter signed by Dewan Rakyat Secretary Ridwan Rahmat stating that in order to ensure the safety of all MPs in attendance, each of them will need to be tested. According to the letter cited by Malaysia Kini, COVID-19 screening tests will be carried out in the Parliament complex between 9 a.m. and 3 p.m. on May 14th and 15th. The letter also said MPs can choose to go to a nearby government hospital or clinic but will need to get an official letter confirming that the tests were carried out between 2 to 3 days before the sitting. Should they choose to conduct the test in a private clinic or hospital, the cost will not be borne by Parliament. The Parliament sitting on May 18th will be the first of the year, as well as the first since the Perikatan National Government was formed. Harapan has since objected to the sitting taking place for only one day, as well as the lack of a question and answer session.
Takkan nak buat sidang 1 jam seperti yang dicadangkan sekarang? Apa salahnya disambung 2 hari bincang soal COVID? Tapi ternyata mereka tidak ada keyakinan. Mungkin mereka rasa tidak cukup kuat.
However, PN has defended its decision, saying these measures were taken in light of the COVID-19 pandemic. Yesterday, Health Ministry Director General Dr. Nur Hisham Abdullah was asked by a reporter on whether the ministry advised the government for Parliament to only sit for a day.
With regards to the Parliament, we advise based on data and facts about COVID. So now the cases, for example, whether it's increasing, decreasing, so that situation we advise the government. And in terms of the progress of COVID transmission in this country. That's our role. But other than that, I think it's not beyond Ministry of Health to advise policy matters and etc. So we advise the Prime Minister regards to the COVID-19 transmission.
Those who have visited the Taman Mega or PJ Old Town wet markets recently have been urged to fill in an online form for health screening. Members of the public who visited the Taman Mega wet market in Petaling Jaya between April 11 and April 25th have been urged to fill up an online form. Selangor Menteri Besar Amiruddin Shari shared a post from MPPJ on his Facebook page, which had requested the public to fill the COVID-19 contact screening questionnaire using a link provided. The announcement said that those deemed at risk of contracting the virus would be contacted by the District Health Office immediately to arrange for their samples to be taken for testing. Meanwhile, Bukit Gasing Assembly Person Rajiv Rishyakaran also urged those who visited the Pasar Besar Jalan Othman, otherwise known as the PJ Old Town Wet Market, between April 5th and 18th to also fill up an online form. He said the Klinik Kesihatan Taman Medan will assess all the people who fill up the form and will call in those deemed to be high risk to get tested. He added that most people would not be called for testing, but if they were still worried and would like to get tested, they could do so at any private facility. It was reported the authorities had ordered the 2 wet markets to be closed temporarily after 2 traders tested positive for COVID-19. A DAP leader has warned that MPs could lose their seats if they do not attend the Parliament sitting on May 18th. DAP National Organising Secretary Anthony Lok has reminded all MPs, particularly those from DAP and Pakatan Harapan, that they must attend the Parliament sitting on May 18th. In an online talk show with Bukit Mertajam MP Stephen Sim, he said if they do not attend this meeting, their seats could become vacant and there may be a by-election. He said not only must Parliament sit for every 6 months, but all MPs must also be physically present once every 6 months. The May 18th sitting is called to prevent Parliament from lapsing, but will only sit for a day amid the COVID-19 pandemic. The last sitting was on December 5th last year. Parliament was previously scheduled to convene on March 9th, but was postponed by the new Perikatan National Government. Under the federal constitution, the Yang di-Pertuan Agong must convene the Parliament sitting not more than 6 months from the last day of the previous sitting. The federal constitution also states that the House may declare a seat vacant if an MP is without the leave of the House absent from every sitting of the House for a period of 6 months. Coming up next, being one of the worst hit nations, the US is not going to let COVID-19 continue to keep its economy shut. An increasing number of US states are preparing to lift coronavirus restrictions this week against warnings of many health experts. Another wave of states in the US is prepared to lift coronavirus restrictions this week, despite health experts warning there is too little testing being done. Colorado, Mississippi, Minnesota, Montana and Tennessee this week will join Georgia and other states beginning an experiment to reopen. Health experts warn that they do not have the testing and contact tracing infrastructure needed to prevent a resurgence of infections of the virus that has already killed more than 54,000 Americans. Tennessee will allow restaurants to reopen, and Montana will let businesses reopen if they limit capacity and practice social distancing. Meanwhile, states like New York, the epicenter of the outbreak, have extended restrictions to mid-May. New York Governor Andrew Cuomo said some businesses such as construction and manufacturing in less hard-hit regions of the state may start to reopen next month. He said the US Centers for Disease Control and Prevention wants hospitalization stable and decreasing before reopening is considered. North Korean leader Kim Jong-un has been laying low recently, but why exactly? That remains a mystery. South Korean officials emphasize that they have detected no unusual movements in North Korea and caution against reports that North Korean leader Kim Jong-un may be ill or is being isolated because of coronavirus concerns. At a closed-door forum on Sunday, South Korea's Unification Minister Kim Yon-chul, who oversees North Korea engagement, said Seoul had the intelligence capabilities to say with confidence that there were no indications of anything unusual. Rumors and speculation over Kim Jong-un's health began after he did not appear in public at a key state holiday on April 15th. He has since remained out of sight. Experts have cautioned that Kim has disappeared from state media before and that gathering accurate information from North Korea is difficult. South Korean media last week reported that Kim may have undergone cardiovascular surgery or was in isolation to avoid exposure to the coronavirus. Unification Minister Kim cast doubt on the report of surgery, arguing that the hospital mentioned did not have the capabilities for such an operation. An authoritative source familiar with US intelligence reporting said it was entirely possible Kim had disappeared from public view to avoid exposure to COVID-19, and the sighting of his presidential train in Wonsan did suggest he may be there or have been there recently. But the source said that since there was no authoritative backing for such a conclusion, US agencies were also considering the possibility Kim might be ill, even seriously. That is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll see you again tomorrow, same time, same place. So, Michael, thank you for watching.